So earlier in the week, I attempted to contact Ascension CEO Joseph Impeachike regarding several issues that I had as a patient in their hospitals in Alabama, specifically St. Vincent's East Hospital. I had some emergency department visits there, a number of misdiagnoses, and I also believe I was a victim of patient dumping in this hospital. You can hear my original message following what I'm about to play here, and it will lay out in detail my concerns. All right, so I received this call from a gentleman who identifies himself as being in the risk management department of St. Vincent's Hospital, and I guess this is in Birmingham, Alabama. So this call, it was made 11 a.m. on 10/15/2021. Yeah, I found this phone call to be totally lacking of professionalism, and I'll list some of my critiques here. All right, first of all, if you're in a company and you're dealing with the public, when you make a call to a customer or to a client, in this case a major hospital in the United States of America, I was a patient. So here's what shows up on my caller ID, and it says restricted unknown. So here the hospital representative is calling me, and the number data doesn't show up. That's a big red flag. Second concern, he gives his first name. I couldn't make it out in the audio. It's unintelligible. Maybe you can hear what he said, but I couldn't figure out what he said his name was. But it sounds like he gave his first name only. And again, you're working for a professional company. You're dealing with the public. When you call people, you need to give your first and last name. All right, that's just basic professionalism. But see, the situation in America in 2021, this has declined to such a low level, and it's because people don't complain more, and they don't challenge these big businesses. The standards degrade. Assert your rights, assert your standards if you have some, and we need higher levels of professionalism in these major hospitals in the United States of America. All right, the third major concern with this call, he says he was relayed a message. He says that I called Ascension St. Vincent's because I had a problem with the health care of my father, and this is not true. You can hear my original message I left for Ascension CEO Joseph Impeachike following this upcoming recorded message. And I was not calling about my father's health care. I was calling about my health care, and I clearly outlined this in my phone call. So between that message being received, relayed, and by the time it reached this gentleman in risk management, the message had been lost. Yeah, and so they don't even know the reason that I called them, because of miscommunication apparently. So here I'll play the message, and then following this you'll hear my original called Ascension. Doctors out there, medical professionals, maybe more importantly than what I say, note the images and read the records that appear on the screen visually. Because if you can understand what's being shown here, you'll know the exact reason for my concerns and my valid complaints.
And this is Vincent at Risk Management at St. Vincent's. I was giving you a call because a message got passed along to me from a Kimberly Zia about you having some issues with your father's care when he was here. If you could, just give me a call back and kind of go over exactly what what your issues were and see if we can help you out. My number is going to be 205-838-6304. Thanks. Have a blessed day.
Thank you for calling Ascension. At this time, our administrative office is closed and our associates are working from home to limit the spread of the coronavirus. To leave a message in the general delivery mailbox, please press 2. Thank you. You've reached the Ascension System Office general mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impeachike, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impeachike, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.